Greetings. Let us review endoscope reprocessing. And this is very important for every endoscopy nurse and technician to understand, and this will help us control infection in the endoscopy suite. First, let us talk about some definitions: cleaning, disinfection, and sterilization. Three important definitions. Cleaning is basically removing organic material and microorganisms using detergent. You basically get rid of the organisms, but you don't kill them. Disinfection is you kill majority of the organisms using a liquid chemical germicide. In disinfection, you do not get rid of the spores, but you get rid of all the microorganisms, bacteria, most of the viruses except for an occasional one. And sterilization is killing the remaining microbes, including the bacterial spores. And one can use either heat, gas, liquid to clear off all the microorganisms, including the spores. So we learned about three important definitions: cleaning, disinfection, sterilization. So in the healthcare, we use a lot of equipment, and the equipment is categorized into non-critical, semi-critical, and critical according to Spalding. This is known as the Spalding classification of medical equipment according to the risk for infection. So here is a storage device. It is a non-critical item. And what is a non-critical item? This is a device that just touches the skin or might not even touch the patient at all. And these are cleaned by using just a regular cleaning and low-level disinfection. Other examples include stethoscopes, supply cards, patient beds. These are all known as non-critical items. The next is an endoscope. Endoscope is a semi-critical item. It actually touches not only it touches the mucosa, but does not penetrate the tissue. And semi-critical items like the endoscope require high-level disinfection. How about the biopsy forceps or the injection needle? And these are labeled as critical items because they penetrate the sterile tissue or go into the vascular space, and these are critical items and they need to be sterilized. You want to get rid of all the bugs, including the spores. All right. Another important thing, you need to know about material safety data sheet. This is a sheet that accompanies all the chemicals and identifies them and provides details about physical hazards, flammability, and also health hazards. That's one document you need to know in the endoscopy suite so that you know which agent is going to cause which problem. And the other one is called manufacturer's instruction for use. So every manufacturer provides an instruction for use about how to use a particular piece of equipment and also how to take care of it. So these are two important documents that every endoscopy technician should be aware of. So now coming to endoscope reprocessing. We talked about cleaning, disinfection, sterilization, non-critical, semi-critical, and critical items. So having those definitions under your belt, let us look at an endoscopy unit It has a reception area, patient preparation and recovery area, rooms for procedures, and then in the last row from right to left, scope cleaning, high level disinfection, scope drying, scope storage, and then from the storage you take the scopes to the endoscopy unit. So let us see what happens. So here are the rooms where endoscopy is performed, and here is the room where it is done, and this is the layout of the room. You have a patient's bed, endoscopy tower, tech prep table, anesthesia machine, nurse's station, sink, and various containers for shops, waste, etc. So you start after the scope, after a procedure is done, you go to the tech prep table inside the patient room where you do the pre-cleaning. So that's the most important thing that you need to do immediately after the procedure. Once the scope comes out, the scope should go through pre-cleaning. From there, you bring the scope to the soiled scope cleaning area and high level disinfection area. So let us look at how a room is set up, the soiled scope cleaning room and high level disinfection room. So as you can see here, there are one-way exits from one to the other, and in the soiled scope cleaning area you have a rack for the scope storage, you have a leak test table, hand hygiene sink, waste container, sinks, laundry bin, and hookup blocks, and scope inspection. And then if you move to the next room, you have the high level disinfection room with automated endoscope reprocessors. So once you bring the scope to the scope cleaning area, you leave it on the rack for soiled scopes, and from there the personnel in charge of this area will first do the leak test. And after the leak test, once the scope passes the leak test, they take the scope to the sinks for manual cleaning. And once manual cleaning is done, you take the scope to the scope inspection area to make sure there is no damage to the scope, and after that you take it to the high level disinfection area for high level disinfection using the machine. Once the scope goes through high level disinfection, then you take it to the next room for scope drying and then for scope storage. So as you can see, there are a lot of different steps, and let us go through these steps one more time so that you understand the reprocessing steps. In the procedure room, we do the pre-cleaning. In the scope cleaning room, we do the leak test, followed by manual cleaning, visual inspection, high level disinfection. Then in the scope drying area, we dry the scope. In the scope storage area, we keep them stored. So pre-cleaning, this removes debris and microorganisms inside and outside the endoscope. Once you come to the leak test, it detects any holes inside and outside the scope. If there are holes, you cannot take that scope for further processing. You need to just wipe it, and then depending upon the size and damage caused by the leak, you send it to the manufacturer for repair. If there are no leaks, you go to the manual cleaning, which prevents biofilm buildup by flushing and brushing the scope's inner channels. So manual cleaning is an art, and if you do it right, you save a lot of people from getting infected. And after the manual cleaning, You inspect the scope under a magnifying glass with a nice lighting for cracks, discoloration, and retained debris under the elevator in the case of an ERCP scope or an EUS scope. Once you feel that there are no cracks and no debris, you take it to the high-level disinfection. If you find that there is debris, you go back to the manual cleaning. So here the scope looks good. We take it to the high-level disinfection, which destroys vegetative microorganisms, mycobacteria, fungi, and viruses. And by going through a good high-level disinfection after pre-cleaning, leak test, manual cleaning, visual inspection, you can really assure your patients that your scopes have been gone through a thorough reprocessing. Once it comes out of the machine, you take it and do the drying. This prevents the growth of microorganisms by drying the scope channels. Any amount of moisture will allow the bugs to grow inside. So you want to dry the channels. And following that, you store them vertically, as you can see here. And some of these storage areas can have a special mechanism to continuously blow air, and this prevents the growth of microorganisms by keeping the channels dry. I hope this video is useful to appreciate the different steps. Thank you.